Northeast Indiana Hospital Group is looking back years later and says the COVID-19 pandemic eventually had a positive lasting impact on healthcare operations. The highly contagious virus that first started spreading across the world more than 6 years ago threw healthcare workers for a loop as hospitals were initially overwhelmed with seriously ill patients. WANE 15's Allie McKibben spoke with an expert and explains effects they still see today.
It has been almost 6 years since COVID-19 had started spreading through the U.S., which called for a quick nationwide adaptation, especially within healthcare.
We learned how to provide care in new areas and in new ways that we never had before.
While some pandemic-age practices were set aside, just like these masks, others stood as new molds and new standards of healthcare.
Dr. Jeff Ford is the Chief Quality and Safety Officer for Parkview Health System. He says healthcare has been pushed to fit community and individual needs.
I practice as an endocrinologist here with Parkview Physicians Group, and probably roughly 1 in 5 of our patient encounters now are virtual visits.
A rise in telehealth reliance is one example. Board says it's especially helpful for patients who need ongoing checkups, like type 1 diabetics.
I can provide all of the care they need at a virtual visit, and we can together, through a virtual visit and sharing data electronically from things such as their continuous glucose monitor device, manage their care without them ever having to leave home or to leave school.
Another example Board cites is meticulous data distribution. He says the infrastructure set up for hospitals to share individual statistics with each other and statewide agencies during the pandemic is still running today.
We now have vastly more data and are able to share that data to help provide guidance to the healthcare system to meet the needs of the community that we didn't have in the past.
But other pandemic-aged hospital practices set aside for now may be making a comeback sometime in the future.
We know that there are threats to public health related to existing known respiratory pathogens.
Board says the U.S. is at risk of losing high-risk elimination status for measles, since there has been a high volume of cases in the past year. But if measles or a new virus start to spread at alarming levels, Board is confident that these adaptations in healthcare have given both patients and providers a leg up for tackling any potential pandemic or outbreak.
Board had also shared how the pandemic had quickened innovation and reshaped the ways hospitals treat their employees. And you can read about those topics right now on WANE.com. Reporting from Fort Wayne, I'm Allie McKibben, WANE 15 News.